Hello my dear students, I am Dr. Vaishali Bharambe, Professor Anatomy. Today we are going to talk about Bell's palsy, which is damage to the facial nerve. Come, let's understand. So, facial nerve, as you know, is a long nerve. It has a long course. It can be damaged anywhere along this course. How do you know? How do you treat if you don't know where it's damaged? So remember, associated symptoms will help you to go to the exact point where the facial nerve is damaged. Please come to the screen to understand what I am talking about. You can see a table here. Primary lesion of the patient is facial paralysis, but he also has associated lesions, which will help you to tell where the exact injury is. So what happens? Sometimes only lower half of the face is paralyzed. Surprisingly, it means the patient has an upper motor neuron lesion. Sometimes patient is coming with a sixth nerve lesion as well. So eye is having a medial squint. LR6, lateral rectus is gone. So eye is medially rotated. Okay. In that case, the injury is in the pons where the facial and the abducens nerve nuclei lie very close together. Excessive sensitivity to sound. I can't bear this sound. This is too much. This is damage to your stapedius muscle, okay? So which means the injury is in the middle ear. Loss of sensation of taste to anterior two-thirds of tongue. Which nerve is gone? Chorda tympani, which is given off in the middle ear. So the injury is proximal to the chorda tympani branching from the facial nerve. So injury is again in middle ear. Finally, when the patient comes with pure paralysis of the face, the injury is likely to be along the extracranial course. Okay. So thus associated lesions will help you to understand where the exact injury is to your facial nerve. An interested student, I request you to please study the point number 1 a little further, and also remember sometimes in patients of hemiplegia, despite the entire paralysis of facial nerve, emotional movements of face are preserved. If you are interested, you can read upon this. Right. So we said that paralysis of facial nerve is known as facial nerve paralysis or facial palsy. How do you see this patient? What you do is you listen to the patient's presenting symptoms. What is he coming with? Then you observe the patient, see the patient, and then you examine the patient. So these are the 3 things we are going to discuss now. Okay. Presenting symptoms. Look at the image to understand. The patient comes and says, my muscle movements of face are affected. I am not able to move them well. My face is looking distorted. I have drooping of my eyelid. I have sagging of the angle of my mouth. These are the presenting symptoms of the patient. Now you begin your job of observing the patient. What you observe is, how is the forehead of the face? Is it smooth? Yes, it is smooth because all the action of occipitofrontalis, which causes some horizontal creases on the forehead, is lost. Look at the eye. It may not be completely closed. It may be incompletely closed with a drooping of the lower eyelid. If the lower eyelid is drooping, you will find some tears dripping down his or her face. You may have the patient coming with a handkerchief in his or her hand trying to just wipe those tears, or maybe tissues. Nasolabial fold is gone. Okay, please use the image to understand better. The angle of the mouth begins to droop downwards. There is saliva dripping down from the angle of the mouth, and the speech of the patient is affected. So this is your observation. You are not touched the patient yet. You are just observing and you see all these things and you have thought, okay, this is facial palsy. So if you're liking this lecture, do please like, share and subscribe to my channel and hit that bell icon. Now you begin your tests on the patient, okay? How do you test? You ask your patient to look forward and without moving the head, ask the patient to look up. You will find the patient causing horizontal wrinkles to come on his forehead. But if the patient is affected, these wrinkles will not be seen. Ask the patient to tightly close his eyes and you try to open it gently. If the eye is affected, you will be able to do so because of the weakened orbicularis oculi muscle. Ask the patient to show his or her teeth. Ask the patient to smile. The side which is normal, okay, that side will rise up because that side muscles are active, other side muscles are paralyzed. So that side muscle will rise up, okay. Blow, ask the patient to collect air in the mouth. Now gently tap on the mouth. The side where it is paralyzed, the buccinator will not be able to hold the air in and you will clearly see air escaping out. These are tests to test for facial nerve palsy. So what are the causes of facial palsy? All these are the causes of facial palsy. Hypertension, stroke, severe diabetes, viral infections and so on. But most importantly, it is an idiopathic condition. For some reason it happens. It happens to some people and there is a clear chance of recovery. You treat the patient with physiotherapy, you treat the patients with certain medicines and patients do recover. It is very rare for the patients to have a recurrence of Bell's palsy or to have it as a permanent lesion. Okay, you can take a screenshot of this so that you can use it later. Right. But the term Bell's palsy itself, which is associated with facial palsy, usually means a lesion of the facial nerve in the facial canal. The nerve swells up, the narrow facial canal compresses the nerve, causing a temporary loss of function of the nerve. That is specific definition of Bell's palsy. Thank you very much. It's been a pleasure, as always, taking a class for all of you. I hope you've enjoyed it too. If you have any doubts, of course, put them in the comment section and I'll do my best to get back to all of you. Thank you so much. For detailed anatomy lectures, surgical anatomy videos, downloadable notes and MCQs, do please visit my website www.vpanatomy.com. If you enjoyed this lecture, do please like and subscribe to my channel.